Hi, it's Rob Shapiro from Technique Peak. Taking a look at patients' end range knee flexion. So you have your ACL, they're doing really well, they just don't quite have that end range. And we keep doing, bend your knee. We keep going up and we might do our glides, we might do glides with rotation. But when we get to end range techniques, when you go all the way back, you have the femur and you have the tibia, and you go all the way back to flexion, you get to a point where the glide's gonna be back, but then you're gonna have this teetering, I call it, right? This tipping forward that you have to get back to get underneath the bottom of the condyle. So what we do is we go all the way up as far as we can get to, right? Sit in his foot, I come behind, almost like I'm doing an anterior draw test, relax in there. And then my mob now is an anterior glide. So now what we're gonna do is we're taking the visual is if I was doing flexion, the glide would be this way with maybe some rotation, but we did that already and we still don't have it. So now we're gonna go to the end and we're gonna pull this way, which is gonna take the tibia and tilt it a little bit more forward. That's an end range technique. You might have some capsule tightness in that even some of the anterior part of the capsule might be tight, not allowing the tibia to glide back as it should. So we come underneath like we do for our anterior draw, we make sure he relaxes his hamstrings. I push to relax them, take my fingers from behind, hand up here, and I do my more of an anterior draw. I could hold it, right, if I like to do more of a take up the slack and hold it and stretch. Or I could be more Maitland-like and do a grade 4++. I could take it to its end range, I could do little oscillations. And relax. So I know when I retest it, in order to get that flexion, I'll test it, I'll put them in flexion. Sometimes I'll do some rotation of the ankle to make sure we get the tibia to be really in that last part of the capsule to stretch it. So it's a nice technique for end range, specifically some of your ACLs you haven't quite got to that point yet. Rob Shapiro from Technique Peak.